it you said to the Prime Minister?
So what did I say to him? I said, as a future doctor, what guarantees can you give me that the system that I work in will have drug accessibility? And then I also said, and as a doctor who will be working in the future, how will you prevent the climate crisis that is currently being allowed to continue under your government?
And did he give you an answer?
I was pushed away. I was told, so basically, I just came out of clinic, and I was told that Boris Johnson was coming, and I was like, oh my goodness, that, like, as a normal person, you never get that opportunity to say something to someone like that. I really want to ask him, like, what's next? And I was told I wasn't allowed to ask him any questions, which I think is a really good sign. This is a PR stunt. People who work in this hospital know the reality of cuts. Like, I'm a medical student, I don't know the reality of cuts in the way these people do. They were all really angry to hear that he's coming here for a PR stunt, because we know what cuts have done to our NHS. We know that NHS is being privatised, even if it's not explained in explicit terms. I mean, Jeremy Hunt literally wrote a book about how to privatise the NHS, and he was scared to be asked questions by members of the general public because he knows that what he's done is indefensible when you look at the reality of waiting times, when you look at the reality of people not getting that treatment when they need it, not because of poor medical care, but because of cuts that prevent it from happening.
What's the mood among staff at the hospital having had Boris Johnson come in?
Ooh, okay, so we weren't told that he was coming, and I think that's a really big sign, because as a Prime Minister, you should be proud of how you're leading your country. We were told that we weren't allowed to know he was here. I literally only happened to be in that place at that time, so most of the staff in this hospital had no idea that he came. It was very much a through the back door kind of affair. We weren't allowed any kind of contact, so I think it's hard to know the mood because no one was able to process that emotionally. This is very spontaneous for me. I didn't expect there to be cameras here. I was just gonna go home and have some lunch before coming back this afternoon. But yeah, I think it's one of frustration, because as doctors we practice evidence-based medicine, and politics should be evidence-based too, and yet the health outcomes from his policy changes show evidence-wise that doesn't work, and we shouldn't keep doing that, and he's too much of a coward to actually speak to any real members of staff rather than just some random medical student who happened to get in front of some cameras about the reality of those cuts.